Recognizing signs of distress in an infant is crucial, as babies can't communicate verbally. Here are common warning signs that may indicate an infant is in distress and needs medical attention. Difficulty breathing in an infant is a serious warning sign and can appear in several noticeable ways. A baby may breathe very quickly or take very shallow breaths, which means they are not drawing in enough air with each breath. You might hear grunting sounds with each breath. This is the baby's way of trying to keep their airways open. Labored breathing means the baby seems to be working hard to breathe, and you might see other signs of this, such as their nostrils flaring wide with each breath, as they try to take in more air. All of these signs mean the baby is not getting enough oxygen and should be seen by a doctor right away. Fever in infants under 3 months old is considered a medical emergency because their immune systems are still developing and are not yet strong enough to fight infections effectively. A rectal temperature can be an early sign of a serious infection, such as a urinary tract infection, pneumonia, or even meningitis. Because infections can spread quickly in young infants, doctors often recommend immediate testing and treatment to rule out potentially life-threatening conditions. Persistent high-pitched crying in a baby, especially if it sounds different from their usual cry, can be a sign that something is wrong, such as pain or irritation in the brain. This kind of cry can happen with serious conditions like meningitis or increased pressure in the brain. If a baby suddenly stops feeding well or refuses to eat, it can be a sign that they are not feeling well. This is especially concerning if it's a new behavior or if it's happening along with weight loss or unusual sleepiness, as it may mean the baby is not getting enough nutrition. If the baby is vomiting often or the vomiting is forceful, that could also point to a problem. Vomit that is green or contains blood is especially serious, as it may mean there is a blockage or problem in the digestive system, and the baby should be seen by a doctor as soon as possible. Diarrhea in a baby can be a sign of an infection or inflammation in the intestines. This can be dangerous because it causes the baby to lose a lot of fluids quickly. If the baby also has fewer than 6 wet diapers in 24 hours, it's a clear sign of dehydration, which is very serious in infants and can happen fast. So it's important to get medical help if you notice these signs. So recognizing the early signs of distress in an infant can make a critical difference in their health and safety. Early action can help prevent serious complications and ensure your baby gets the care they need.